I know there's so much anxiety out there. We're going to try to walk everybody through what's going on this morning.
Yeah, we're going to try to calm some fears, but also give you the facts.
Yeah, and some perspective as well. So America's testing crisis is really the lead this morning. Dr. Anthony Fauci, who's the head of the NIH Infectious Diseases, delivered a sobering message to Congress and saying bluntly, we're failing to meet capacity and do what we should as far as testing is concerned. The president is claiming this morning that help on this issue is on the way.
As the crisis sweeps the nation, the toll is growing by the hour. At least 4 states, including Oregon and Ohio, have now ordered all schools closed. It's a desperate measure that could have far-reaching impacts on the economy.
Well, that would spell even more bad news for Wall Street, but boy, they don't need it. The markets are reeling in the wake of the worst trading day in 33 years. We've got the latest on all of these moving pieces. Let's start with NBC's Tom Costello with an overview. Tom, good morning.
Hi, guys. Good morning. So this pandemic, of course, has created a major health scare. It's put Wall Street into that steep slide, and it's threatening main streets across the country now, from big companies to small mom and pop shops, as Americans hunker down to ride this thing out. As the federal government races to respond to the coronavirus pandemic, the nation's top infectious disease expert is sounding the alarm over a lack of testing kits for Americans.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
One ER doctor in New York expressing frustration, telling Live Science, we definitely had patients come in expecting tests. They've been told that they could get a test. I think there have been lots of mixed messages, with health officials urging the public to practice social distancing to slow down the outbreak. Communities around the country now taking action.
We must treat this like what it is, and that is a crisis that we have not seen, most of us, in our lifetimes.
Ohio shutting down public schools for 3 weeks. Maryland schools closed for 2. Also, New Mexico, Michigan, and Oregon schools. California now banning all gatherings of 250 people or more. And New York City's mayor declaring a state of emergency.
But the last 24 hours have been very, very sobering.
Meanwhile, President Trump is defending his decision to ban most Europeans from entering the country for the next 30 days.
I just wanted that to stop as it pertains to the United States, and that's what we've done. We've stopped.
The president even acknowledging travel inside the United States could also be restricted.
We haven't discussed that yet. Is it a possibility? Yes. If somebody gets a little bit out of control, if an area gets too hot.
Also this morning, the White House is acknowledging the president attended an event at Mar-a-Lago last weekend with a Brazilian government official who's tested positive for the virus. Pictured here with the president, here alongside Vice President Mike Pence. The White House insists the president had almost no interaction with the individual and does not require a test at this time. Over on Capitol Hill, Republicans and Democrats are inching closer to an emergency aid package to help Americans impacted by the outbreak. The package would include expanding funding for paid sick days, shoring up safety net programs like food assistance, and funding for free coronavirus testing. Meanwhile, in Canada, the government is facing a different kind of obstacle. Prime Minister Justin Trudeau will be in isolation for 14 days after his wife tested positive for coronavirus. The Prime Minister, we're told, is in good health with no symptoms. Breaking this morning, we've learned that the Australian Home Minister, Peter Dutton, has tested positive for the virus. That matters for us because on March 5th, he was in Washington. He met with Ivanka Trump, as well as the Attorney General, William Barr, as well as Kellyanne Conway, the advisor to the White House. And now Mr. Dutton is back home in Australia. He is in a hospital in Queensland. One other note, an American Airlines pilot based in Fort Worth has tested positive for the virus, but the airline believes that the risk to the flying public was minimal. Ladies, back to you.
All right, Tom Costello, thank you very much.
Seemingly overnight, much of our daily lives have been put on hold. This morning, the list of closings and activities being suspended is growing from coast to coast. All Americans now trying to navigate what we're kind of calling a new normal. We do have a shot from New York's Penn Station. Normally, Penn Station is packed with commuters. This is what it looks like at this hour. NBC national correspondent Miguel Almaguer has that part of the story. Hey, Miguel, good morning.
Hoda, good morning. From school children to sports stars, the lives of millions of Americans are being severely disrupted by the coronavirus pandemic. Schools, work, even iconic institutions like Broadway and Disney World are shut down. Experts say the economic impact could be immense in the long run, not to mention the emotional toll it's taking on a nervous nation.
Normally bustling streets suddenly quiet. Mass transit systems now free of crowds. Restaurants where reservations are usually scarce now hurting for customers. For millions of American families, plans are changing fast. At least 6 states, including California and New York, banning large gatherings of people. One of the biggest disruptions, schools from kindergarten to college closing their doors. Parents nationwide now scrambling to care for kids who are suddenly home for the foreseeable future.
I don't have the option just to take time off, so here they are.
Theme parks, including Universal Studios, part of NBC's parent company, NBC Universal, Disneyland, and Disney World, now closed until at least the end of the month. Sports arenas are empty. The NCAA's annual March Madness canceled. All major professional sports leagues have suspended games. The NBA now saying it will reassess whether to finish the season after 30 days. Overnight, NBA Hall of Famer Charles Barkley announcing he's self-quarantining after getting tested for the virus.
I haven't been feeling great, and they didn't want me to take any chances. So they told me to quarantine myself for 48 hours.
The economic impact will go far beyond fans and players, affecting arena workers, freelance photographers, sports reporters, vendors, parking lot attendants, and many more. While Cleveland Cavaliers star Kevin Love announced he will donate $100,000 in support of the Cavs arena and support staff that had a sudden life shift due to the suspension of the NBA season. Great cultural institutions, from Broadway shows to museums to concert halls, are going dark. But in a region hard hit by COVID-19, the Seattle Symphony streaming Mahler's First Symphony for free, providing a sense of calm during the crisis.
Disney says its theme park will pay its workers during the closures. Other large corporations have similar policies in place, but so many people say their jobs are indirectly connected to places and events that are being canceled. Guys, back to you.
All right, Miguel, thank you.
The economic story is a big one. We're going to have more on that in a moment. But for the moment, let's turn to NBC News medical correspondent Dr. John Torres. Dr. Torres, we've talked a lot in these last few days about this issue of testing, the availability of testing. Other countries seem to be doing it at a more rapid and more efficient pace. Dr. Fauci was very blunt about it yesterday.
Very sobering when he said that.
So how serious is it? If you're not testing right, what does that mean for how we're trying to attack the coronavirus?
So testing is essentially the linchpin of getting this under control, because without testing, we don't know where the epicenters are in our country. We don't know where the outbreaks are. And that means we don't know where to put our resources. We don't have infinite supply of resources. So
and we don't
need
know
to make
where
sure,
it's spreading.
And we don't know where it's spreading, more importantly. And I've talked to a lot of researchers. I've talked to a lot of doctors. And the theme you hear throughout everybody is basically saying, we need more testing. We need more testing. You hear that constantly. I agree with them.
A lot of people we see anecdotally, people who say they're sick. They have flu-like symptoms but don't have the flu. And they are saying that the CDC is saying there are 2 criteria. You have to fit in both of these criteria in order to get this test. One is that you've traveled outside the U.S., and 2, you've been in direct contact with someone who tested positive. So they're saying we can't get tested because they won't let us test.
And we know that this does pass through community. There's community spread of coronavirus.
Is that true, though?
I thought
it
they
is
had
true.
loosened up the restrictions on testing.
They said they were loosening up the restrictions on testing, but if you talk to most doctors, they'll say, I'm frustrated because I have tried to get these tests. I have called public health departments, and they're still putting these restrictions in place. I think part of the process is we haven't got all the tests out there we want. That's the big failing that Dr. Fauci was talking about, and I'm thankful that he actually said that. And so I think once we start getting these testings in place, they can open up more.
How long does that take to roll these, like weeks or days?
Well, theoretically, it shouldn't take long at all. If you look at some other countries, they've done it very, very quickly. Okay. Here in our country, the way it's set up, it's taking much, much longer.
Well, we
and that's
had
one
Vice
of the big
President
issues.
Pence on yesterday, and they were talking about, okay, we're going to have 1 million tests by the end of the week. Then they start talking about 4 million tests. I mean, when you look at the numbers right now, I think we have in the U.S. 1,600 cases. Does that tell you, that number in and of itself, that we are not testing as we should? Shouldn't the number be
It
a
does.
lot higher
It does
than
tell me
that?
that we haven't been testing enough because the numbers will go higher, and that's one of the messages I tell a lot of people is once you start testing, you're going to see these numbers skyrocket because a lot of people have it. Remember, 80% of people have mild to moderate symptoms, might not even know they have it, but they could certainly be spreading it, and so that's a big concern. And that's who you want to test to make sure it gets under control. Some countries are testing everybody who wants to get tested or thinks or even has slight symptoms. Here in this country, we've restricted it more.
You know, I had a question about kids. I was just, thankfully, one of the silver linings here is that kids don't seem to be as susceptible to this. But I did wonder, could kids be carriers of COVID-19 and be passing it around even if they themselves have no symptoms?
They certainly could because some kids have a certain protection to it. We're not exactly sure why. And part of that protection means they're not going to be having the same symptoms we have because of it. But that doesn't mean they don't have coronavirus. So they could be passing it around. So it's important to teach them the same things we're teaching everybody else about hand washing and social distancing.
Yeah.
That's why shutting schools down in some instances is a really good idea.
Okay.
Dr. Torres, hang tight. I know we're going to see you in a little bit. Thank you.
Now we're going to talk more about the financial toll of this outbreak. Stocks are coming off the worst day on Wall Street since Black Monday, the crash of 1987. The meltdown erased nearly all of the gains in recent years and marked the end of the longest bull market on record. NBC senior business correspondent Stephanie Ruhle is at the New York Stock Exchange. Steph, a lot of people are wondering what is today going to bring. What do you know on futures?
I do have some silver lining for you. Futures are actually up today. And just stay with me here. In China, all 42 Apple stores have reopened. We know that in China and South Korea, the numbers are going down. And I know yesterday was absolutely brutal. We also know that the increase that we may be heading into a recession is much more likely. But think about this. Because of all these cancellations, live events, theme parks, schools, businesses, limiting travel, what we are now finally doing is assessing and addressing this spread. And the sooner we can deal with this sickness, imagine it's like our kids, and we're saying, you know what, if you've got a fever, you got to go home from school for 72 hours, and when you're better, then you can go back to school. So from a market's perspective, they're absolutely concerned that putting pause on society, American culture, our economy is going to hurt us because we're not going to be out there spending. But the pause, the sending everybody home sick, will get us sooner to the other side. And once we get to the other side, we can return to daily life.
Right. That's the whole point. You have to take care of the public health issue first. But, in the meantime, to extend your analogy, Steph, the economy is now sick. The economy now has a fever and a flu and a hacking cough. And that's real, even if it is a reaction to these precautionary steps that we've had to take.
That's exactly it. And that's why it's complicated. We've gone from a public health emergency to an economic crisis. But in order to address the economic crisis, people down here are saying, let's address the public health emergency first. So we're doing that. But what it's going to do to our economy, just think about it. Once everybody's sent home, we're not spending. And we don't know how long this is going to last. And that is certainly going to depress the economy. And it's a major concern. Even think about your small businesses. Even if there are loans extended to local restaurants so they can make rent for the next 2 months, nobody's going to be in there eating. So when people return to those restaurants, you can't make that money back. Right. So without a doubt, we now have to face a completely new economic climate, but it is a good thing that we're finally addressing these things.
Yeah. All right. Stephanie Ruhle. Stephanie, thank you.